I'm Dr. Mike Bozivich here at the downtown clinic. I'm a general internist and I've been in practice since 1980, almost 32 years now. I was in private practice for the first 13 years in a small group, and then that group was purchased by HealthEast in September of 1993. Since 1993, I've been a very happy employee and physician for HealthEast. I have the privilege and honor of being the site medical director for the HealthEast Downtown Clinic, and I've been the site medical director since 2002. Well, HealthEast affords me what I always wanted when I started practice, that is the ability to combine humanities with science in dealing with patients. And I've developed a very nice private practice those first 13 years, and that's kind of continued. HealthEast is a wonderful organization that allows me to practice the style of medicine, the private practice, traditional internal medicine that I was trained to do over 30 years ago, and I'm still happy to say I'm still practicing it. HealthEast has a wonderful group of physicians. There's 8 internists in our group with 1 endocrinologist and a podiatrist every Tuesday afternoon. That's been a wonderful opportunity to rub shoulders and bounce things off of great physicians in the field of internal medicine. And we're right next door to HealthEast St. Joseph's Hospital, which is a community-based hospital but practices tertiary care in many different settings, especially neurosurgery and cardiology. I think the pervasive feeling in HealthEast is that it's definitely a patient-centered organization, and that's very important. The patient is really the focus and the center of all of what we do at HealthEast. So whether it's internal medicine, whether it's neurology, neurosurgery, or whether it's cardiology or oncology, the patient always comes first. And I think that HealthEast also, since its origins in the late 80s, has always been a Judeo-Christian organization with strong emphasis on the culture of the community, this East Metro area. That, combined with patient focus and the patient being the central part of our care and attention, is a very important thing to me. There are many different organizations in the East Metro area and in the Twin Cities. This is a burgeoning area for medical practice. The Mayo Clinic is 75 miles away, Rochester, Minnesota. The University of Minnesota and all of its training hospitals is just 10 minutes away. We're all connected by freeways. It's a very close-knit organization of medical groups, medical practices, healthcare delivery systems. But what makes HealthEast different is because it is so patient-focused, and because HealthEast recognizes those physicians by means of compensation, etc. It's a well-run organization because the physicians have an input, and the physicians are recognized not just with a pat on the back, but with a compensation model that rewards that kind of behavior and that kind of attitude among the physicians and that kind of caring spirit.